Sarah, are you going to be for Dr. Padati in case we have any testing? Good afternoon. COVID-19 and the new information continues to hour. And for that reason, ones have the most up-to-date. Today, we had one additional positive case of COVID. Is an Alameda County resident between the age of 40 date. We are expanding testing capabilities at the State Hygienic Lab. We are now running 3 shifts over a 24-hour period for a total capacity of 162 tests daily through the State Hygienic Lab. As of noon today, the State Hygienic Lab has testing supplies on hand to test 620 individuals. We'll be reporting both positive and negative results to the State Hygienic Lab daily, and that's really important so that we're able to track Iowa's results. Care resources responsibly. Testing from COVID, and testing is being prioritized. No alternative diagnosis. Older adults above the age of 60 with fever, cough, or difficulty breathing, and underlying health conditions like heart, lung, kidney diseases, or weakened immune systems. Individuals with a fever or respiratory illness who live in dormitories or long-term care, residential, treatment, or correctional facilities, and essential services personnel with fever or respiratory illness, such as healthcare providers, fire, EMS, law enforcement, and residential facility staff. Earlier today, I also issued an additional health emergency declaration effective immediately that provides additional regulatory relief to Iowans that have been impacted by the COVID-19 pandemic. First, we're suspending penalties and interest as it relates to the collection of property taxes, and this delay will hopefully help families, businesses struggling with cash flow issues. Second, the order helps Iowans stay in their homes by suspending evictions under Iowa's landlord and tenant laws, including those in manufactured housing and mobile home parks. When we're asking Iowans to stay home, this helps prevent an unnecessary level of disruption during these really challenging times that we're in. Third, the order allows the sale of carry-out, delivery, and drive-through alcohol for unopened bottles for bars and restaurants, and hopefully this will create some additional business opportunities for those bars and restaurants who rely heavily on those sales. Fourth, this action allows government at all levels to conduct business in this era of social distancing by permitting public meetings by electronic means. We're also suspending requirements for special elections to fill city council vacancies. And finally, the order suspends additional regulations to ease the transportation of agricultural supplies and commodities, food, medical supplies, cleaning products, and other household goods on all highways in Iowa. We do, or I do, anticipate further refinements to be made in the days ahead as we're talking to business and industry or various agencies. We're asking if there are regulatory issues that are prohibiting them from doing what they need to do, and so we're looking at that on a daily basis. I fully understand the impact that these decisions have on Iowans and your daily lives, but the more that we do now on the front end, the sooner that we will get through this and we hopefully can get our lives back to normal. Again, I can't say this enough. It's going to take every Iowan working together to be a part of the solution, and I know Iowans are doing their part. It's who we are, it's what we do, and I am seeing story after story of how people are responding to the pandemic that we face today. I've also asked today Workforce Development Director Beth Townsend to join us to provide you with an update on unemployment and the proactive action underway in her department to support Iowa workers. And I just want to thank Beth on the great job that they're doing. They are responding in a phenomenal way and really being a great resource for Iowans who have been impacted through loss of work. Beth?
Thank you, Governor Reynolds. At Iowa Workforce Development, we are working very closely with our stakeholders and partners, including Director Durham at the Iowa Economic Development Authority, Director Paulson at the Department of Revenue, Director Roeder at the Department of Management, the Iowa Association of Business and Industry, the Iowa Business Council, the Greater Des Moines Partnership, the Employers Council of Iowa, the Iowa Restaurants Association, and the Institute for Decision Making at the University of Northern Iowa, as well as our many partners in local media who are helping us get the word out across the state. We are working very hard to lessen the financial impact of a temporary loss of income due to COVID-19 related layoffs. If you are laid off due to COVID-19, if you need to stay home and care to self-isolate or to care for family members or children due to illness related to COVID-19 or because of school and daycare closures, you can receive unemployment benefits provided you meet the other eligibility requirements. We have waived all work search requirements, both for COVID-19 claims as well as for pre-existing unemployment claims. We have waived the work availability requirements with regard to the COVID-19 claims. We are doing our very best to ensure that most people will receive payment within 7 to 10 days of their initial claim. We are also waiving charges to employers' accounts for individuals who file or identify as a direct or indirect result of COVID-19. Fact-finding interviews for those claims have also been waived, although employers will be notified when a claim is made. Customer assistance is available at 1-866-239-0843, but please understand that we are seeing an inordinate amount of calls, and it may take some time for someone to get on the phone. Roughly, we're at about 20 to 30 minutes, so please be patient, stay on the line, and you will get assistance. Our field offices are open on an appointment-only basis, although for those who need to provide proof of identification for an unemployment claim, you can come by our offices. We'll meet you at the door, copy your documents. You'll be in and out in just a few minutes. We are asking other members of the public who need assistance to call their local offices and schedule an appointment. We will try to take care of your need over the phone. Office numbers can be found at iowaworks.org iowaworks.gov under the Contact Us tab. We are attempting to resolve all issues over the phone. We have had several webinars for employers and claimants where we've had thousands of individuals participate. Those were all recorded and have been posted online at iowaworkforcedevelopment.gov, where we created a specific tab for COVID-related resources. Today, we held webinars for both employers and claimants in Spanish, and those have also been posted. We have posted a video today that walks individuals through how to file a claim online, including a Spanish version. Workers' compensation has moved to all virtual hearings, as we have for any remaining appeal hearings. There are employers who are still hiring and in need of employees today, so please check our website if you are looking for work. We know that Hy-Vee is hiring, and we have posted a link to the application page on the front page of our webpage. We are here to help individuals and employers, so please reach out to us if you need assistance or have questions. It may take us a few minutes to get back to you, but we will. We are in the process of training 162 Iowa Workforce Development employees who normally work in areas not related to unemployment insurance to be able to start taking calls on Monday, which should help with the wait times and also free claims processors to focus exclusively on that. In closing, we want to say thank you to the governor for her leadership, to all our partners who have reached out with offers of assistance and support. It's been very much appreciated. Finally, I want to say thank you to all the hardworking and dedicated team members at Iowa Workforce Development. They are working almost nonstop around the clock to make sure we can do what we can to help our fellow Iowans. As the governor has said so often, we are going to get through this, and I know that to be true from watching these inspiring state employees who are constantly asking, what else can I do to help? Thank you.
Thank you, Beth. And finally, before we open it up to questions, to those families who will be returning home later this week after spring break vacations, we also need your help to help mitigate and slow the spread of COVID-19 in Iowa. So please check the CDC's website to see if you've been traveling in an affected area. If so, you should follow CDC and Iowa Department of Public Health guidelines to self-isolate at home for 14 days before returning to your normal routine. Or if you have any questions, please don't hesitate to pick up the call and just walk through maybe where you've been and any recommendations that they may have. Also, call your employer. Many Iowa businesses and the state of Iowa have implemented new travel and work from home policies that may affect you since you've been gone. Again, it is evolving by the day, so call your employer first and just walk through maybe some of the criteria that they've put in place. And if you know someone traveling now who needs this information, please help us share that with them. And with that, we'll be happy to take your questions.
The number one question we're getting is, are hospitals ready? Are they prepared? Do they have enough equipment? Are there shortages? And what are we doing to prepare for that?
So we're doing that on a daily basis, and we have been for quite some time. And that's really why all of us have a role to play. That's why we've taken the actions that we've taken, so that we don't hit a peak and crash our hospital systems or our healthcare workers. And so everything that we do, if you're sick, stay home. If you have a cough, a fever, shortness of breath, call your doctor first. Have them walk you through the assessment. They'll tell you what steps to take. If you're not feeling well, stay home. That's why we closed down the bars and the restaurants. I mean, every step that we're taken was taken to help us slow and bend the curve so that we can be resourceful with the PPE, which is the personal protective equipment, to make sure that we're testing those that we should be testing, to make sure that we're taking care of those that we need to. We're also, we want to make sure that we have the resources for not only our healthcare providers, but our first responders. We're looking at childcare right now and what that looks like. We'll be releasing guidelines later this afternoon. We're working with alternative stand-up childcare facilities so that we can make sure that we can, our healthcare workers and our first responders and our food production people can continue to work. They are standing on the front line and doing a phenomenal job. It's why at the state level we have half of our agencies working at home. Many businesses are splitting their shift. They work in the office one day and at home another. So that's the reason that we put those policies in place so that we can avoid a spike and potentially crashing the healthcare system. We also, we're in contact with our healthcare providers in our hospitals basically on a daily basis, but we also meet as a group, practicing social distancing to really take a look at where we're at, what are supplies, how many days out are you. The government, the administration has continued to release, and with the act that they just passed, with the Defense Protection Act, that will really help businesses, reallocate their supplies to where they need to go. So it's not only happening at the federal level, it's happening at the state level. I have businesses calling and saying, how can I switch what we're doing to help you with masks, with yes, we are at our Department of Corrections. We will be producing hand sanitizer, and we'll be having from our ethanol plants, they'll be sending the alcohol down to the Department of Corrections, denatured alcohol down to the Department of Corrections, so that we can make a hand sanitizer at our Department of Corrections. I talked to Winnebago this morning. They said they have already supplied orders in Louisiana, California, Indiana, I think was another one, trailers for stand-up mobile units, for places for people to stay. So it's really been incredible, the number of businesses that have reached out to say, what can we do to be helpful during this really, really critical time?
Governor, majority of Iowa's counties don't have any ICU beds at all. Do you have a plan to expand the number of ICU beds, especially in that northeast Iowa area where some cases have already been confirmed?
Yeah. one system, one healthcare network. So those are the things that we're taking into account. I know they made some changes for some of our critical access hospitals. So I know, that's when we sit down and we work together and we talk about the beds and the type of beds, that's part of the conversation. And then if we do have some positive cases and they need that level of care, transportation is another piece of that. How do we get them where they need to go? So those are the kinds of discussions that are happening on a daily basis just throughout the day.
How many ventilators does the state of Iowa have right now?
I don't know if I know that for sure.
Sorry, what was
The ventilators? And again, if I give you that information today, that changes on a daily basis. So what you need to know, I think that's the most important thing for Iowans to know, is that it is continually being tracked. We're looking at alternative resources. I'll give you another story. We have at our University of Iowa, they are using 3D printing to print some of the parts for ventilators. We have a partnership in Nebraska with a retailer and how we can stand those up. So those are the kind of things that are happening on a daily basis. Or again, some of our manufacturers, what can we do to assist in making sure that we have enough ventilators, personal protective equipment, masks, goggles. They're all working on that. The prison is making gowns. It's just every day we've got somebody else that's calling. We're looking at different resources. When I talked about public-private partnerships, everybody is stepping up and trying to do their part in making sure that we're prepared and ready.
Will Iowa be getting some of the ventilators that the Department of Defense at the federal level is making available?
We have through FEMA. That's the way that we put in our request, and so that is part of the process. I don't know, Joyce, if you want to add anything to that, but that's basically the way that we would put in the order for those,
Governor,
for that equipment.
did I hear this correctly, that you said the private labs will now start reporting the number of negative tests as well?
Yeah.
And then...
When is that? Does that start Monday or? Yesterday. Okay, yeah.
Okay, and then do we have any idea what you mentioned about the hygienic labs capabilities. Do we have any idea, ballpark, what the private labs testing capabilities are?
Well, we continue to bring on more almost daily. A part of this is the testing kits and then the reagents. So we're also, monitoring those and make sure that we have enough reagents to actually do the testing. We're looking at another public-private partnership that may significantly increase those as well. So we're not leaving any stone unturned. We're continuing on a daily basis through the team, working with the Department of Public Health, and all of our agencies, honestly, reaching out to different individuals that we think could maybe play a role in providing us solutions to make sure that we're meeting the needs of Iowans.
One more question in the room.
Governor, can we bring Beth back?
Sure. Oh, yeah.
One big question that I have is numbers. How are we looking?
We are seeing an unprecedented number of claims. We are going to coordinate with the governor's office and release those numbers next week once we've been able to catch our breath a little bit. But it's pretty staggering to see the number of claims that we're receiving. Essentially, what we're receiving on a daily basis is what we would receive in a busy month.
So ballpark, any?
I don't want to give you any ballpark because they're still being filed, and we'd rather release the numbers when we have accurate numbers, and we're going to coordinate that with the governor's office for release next week.
There was a report that the Trump administration was asking states to hold off on releasing those numbers. Did you get any pressure like that from the administration?
We have not. No.
Thank you.
And we just want to, it's just important that we report accurate information, and it is so fluid. And so even sometimes what I say today is different tomorrow based on new data that's come in. So, but they are significant, and everybody knows that. And I so appreciate the measures that we put in place to not only help Iowans that have been laid off, but also our employers where it doesn't charge back to them, which is really, really important. So what we're doing at the state level will also complement what's happening at the federal level. Next week, we have a whole team working on, small business package and what we can do to really help stand back up some of our businesses that have been, really impacted by the pandemic. And so we're continuing to review things that we need to do that can help our small business again, and Iowans, again, building on what they're doing at the federal level as well.
The next question is going to be from Rod Beauchart at the Cedar Rapids Gazette.
Yes, Governor. The head of the Iowa Restaurant Association recently said she fears that up to half of the state's 6,300 or so restaurants could be forced to close their doors and lay off as many as 80,000 employees in the wake of the emergency order curtailing their dine-in services.
Yeah.
They say they'll need state and federal help to stay afloat. Are you considering using any of the $20 million in emergency spending authority the legislature gave you earlier this month to assist those businesses, or would helping one industry open the door to more financial bailout requests than the state could handle?
Yeah. Yes. Yes, yes, and yes. We are absolutely taking a look at all of that. Debbie's team is working on it. I'm going to put together, an economic recovery task force so I can get, a wide array of stakeholders from around the state, around the table, and really talk about how we stand back up this economy. These are individuals a lot of times that don't have a lot of resources, and so we want to make sure that we're taking care of them. That the eviction notice that we put in the health emergency disaster order, things like that we can do to help Iowans out in the interim, I think are really, really important.
The next question is to Rachel Drozy at We Are Iowa.
Hi, Governor. 2 questions. First, why are non-essential shops like tattoo parlors, shoe shops, clothing stores, etc., allowed to remain open? And 2, I asked this yesterday, but now we're about to be at 3 states that are sheltering in place. Are you still not considering this here?
No, I am not considering that here. What we do, the decisions that I've made, I've tried to make that, or I have made that based on the data that the Department of Public Health provides us in consultation with the CDC. I was on another call last night with governors across the state. Those have been extremely valuable because it allows all of us to see what's happening in other states. Many times one state like Washington or California or New York, they're at a different place than we are, and they can talk about things that the timing and when you do what you do and some of the numbers they're seeing and how we can maybe help, again, slow and spread that peak out. So those have been really helpful to get a sense of what other states are doing and policies that they're putting in place. And so that is a piece of the information that we utilize too when we're making the decisions that we're making. We will, like I said, we're evaluating other areas that we need to take into account. So I'm trying to, there'll probably be in the next couple of days there'll be additional items that will be added to the health emergency declaration as we just address some of the other areas that we hadn't maybe taken into account. A lot of our retail stores have already made the decision to close. Some have not. They have the opportunity, again, to practice social distancing, but we continue to evaluate other industries and sectors that we have not asked to close.
Can I just ask a real quick follow-up to the home and shelter-in-place order?
Yep.
Only because Illinois is going to one this weekend, so now you have border communities that are dealing with this. Do you have any advice or suggestions to those Mississippi River towns in Iowa that just across the river?
Yeah, it's the same thing I've been saying every single press conference. If you're sick, stay home. If you have a cough, a fever, breathing issues, you need to call your clinician. They'll walk through the assessment. A lot of the requirements for the flu are the same for any other illness that you might have. So it's just really important that if you're not feeling well, stay home. If somebody in your household has been tested and we don't know the result yet, you should all self-quarantine until we find out what the test results are. But the more of that we can do and the more of that we can do on the front end, it really hopefully will, again, not cause a lot of disruption to our healthcare system, but most importantly, we'll spread this and we'll be through it and hopefully shorten the timeline, and that's something that we're all working really hard to do. So I don't know the decisions and the numbers. Every governor is looking at their own data. They're doing a similar process that I'm doing here in Iowa. So they're making the decisions based on the information that they're receiving. And, that's what we're doing too. So we take into account what's happening in other states. For instance, Council Bluffs, when we had, one of the Iowans that was tested in Nebraska and in the Omaha area, that impacted our decision for Council Bluffs. And I think it was with that decision that we actually moved to community spread, right? And then with the other positive test in Dallas between the two, that's when we took that next step to community spread.
And then the next question is to Barbara Rodriguez at the Des Moines Register.
Governor,
You said that not everyone who has mild symptoms of coronavirus, like potential mild symptoms of coronavirus, needs to be tested. Then how can the state have enough information to know if its mitigation efforts are working?
Thank you, Barbara. This is Sarah Reister. I'm the Deputy Director of the Iowa Department of Public Health. I mean, I think that we do have a limited number of tests in Iowa. Testing it has three components. It is test kits, it's also reagents, and then it's also swabs. And so as you heard the governor say, we are working to expand testing capacity in our state, and we're working on that every single day. And so we do fully expect at some point in time for testing capacity to expand. And at that point in time, tests might be available to more Iowans. But at this particular point in time, because we do have a limited number of tests available, it's really important that those tests be available for people who are hospitalized, for our essential workers like our healthcare workforce, our law enforcement officers, those sorts of things. And so if you do have a mild illness, the guidance remains the same. You should stay home, and you should stay home until your illness decreases, which is at least 7 days from 7 days from the onset of your symptoms. You need to have at least 3 fever-free days. These community mitigation strategies, they work if everybody adheres to them. And so that's what we're trying to do to limit the community spread of the virus within our communities. And if everybody does their part and they follow these simple requirements, we really hope that we'll be able to flatten the curve of the virus spread in our state.
The next question will be Caroline Cummings at Sinclair Broadcasting.
Hi, Governor. My question is related to the amount of people who could possibly get this. California's governor sent a letter to the Trump administration suggesting that half of California's population could get this disease over the next 8 weeks if more stringent efforts aren't taken and help isn't, sent from the federal government. Has the state considered estimates about how many Iowans this could affect, whether mild or severe? How many sheer numbers of people could get this in this state?
So again, this is Sarah. We don't have modeling like that we would share at this time. Our epidemiologists are paying close attention to what's happened in other countries and in other states. And that's why as soon as we started to see community spread in our state, the Department of Public Health advised the governor that now was the time to take some community mitigation efforts to stop the slow of the spread of the virus in our state so that we don't reach a worst case scenario here in Iowa. We're trying to avoid that worst case scenario so that we don't overwhelm the healthcare system. And so that is why the governor, in consultation with us earlier this week, did take some community mitigation steps so that we can hopefully prevent ever getting to that point in Iowa. As the governor has said, it's an incredibly fluid situation. It changes every day, but we are keeping a close eye on what's happening in other countries and in other states, and we will continue to provide the governor with the advice that we think is necessary to protect Iowans.
But that's why we take the steps that we're taking now, because you don't have a lot of extra time to make those decisions, so you have to be very proactive on the front end.
Next question is to WHO TV. Sonia.
Yes, thank you. So I was listening into a conference call yesterday between Des Moines city officials, and they said the CDC is looking out to, I think it was May 11th, as when there could be possibly some type of turnaround in this. I guess my question to you, having information from the White House coronavirus task force, do you have any type of information on when we might finally start to see a turnaround in this, when people might be able to start to attend larger gatherings again? I know some things have been canceled all the way out to the end of May.
Yeah, so I am not going to make any projections on when this could potentially alleviate and things turn around. I just will continue to say, if we practice the 15-day policies that the administration put in place, if we all do what we should do and be responsible about our hygiene and our actions, I do believe that we can turn this around and start to return back to normal life. But, you know, and that's why we are monitoring other states. We're monitoring decisions that they've made. We're basing on what we're seeing here in the state of Iowa. But you know, at this point, I'm very leery to make any projections about what that would look like or when that would be, except for just to encourage everyone to stay home if you're sick, call your doctor first, and really practice social distancing. And I believe if we do that, we are going to get through this sooner rather than later. So those tough decisions that we've made on the front end will have a big impact on the length of this and how we deal with it.
Last question to Jason Clayworth at the Register, who I'm sure will end us on a positive note.
Thank you. Governor, yesterday we learned the state hygienic lab has materials available to conduct tests on approximately 400 people. We continue to hear from Iowans with serious illnesses and corona-related symptoms who are being told that they do not meet the specific criteria to be tested. And we hear from medical professionals who advocate for widespread testing as a measure to help limit the negative effects of this pandemic. Multiple states have made testing available for millions of residents, and I'm wondering why Iowa's tests are not more readily available. What's being done to address that? And specifically, is your administration reviewing the possibility of drive-through tests?
Well, we actually have several clinics that are already doing that or talking about standing one up. That's another way that we really manage the PPE and the equipment, and we keep individuals from going into the healthcare facilities because we keep them outside of that while we're doing the testing. So we have some that are already doing that. We have several more that are talking about coming online. We want to make sure that we have the materials before we do that. But Jason, I can tell you that every state is dealing with the number of tests and the reagents and the number of people that they can test. And at the federal level, they also have to mitigate and prioritize where some of the hot spots are so that we can start to, you know, tamper this down and do everything we can to protect the health and safety of Americans. And so we're doing our part, working with them and working with the private sector and working with the FEMA and anybody that we can to make sure that we meet the needs of Iowans. We have right now 620 tests on hand, so we can test 620 Iowans, and hopefully, you know, every day that number changes, and we're going to continue to be proactive to make sure that we can meet the needs of Iowans. But I think Dr. Badati, Sarah, my office has gone over who and why we're testing,